Hello, Assalamu alaikum. In this video, we will understand about the Alzheimer disease. Alzheimer disease is the neurodegenerative disorder. In this way, the central nervous system is involving, which that will lead to damage the neuron by the several processes we will understand in this video. The for approach to understand the Alzheimer disease. So the most common cause of the decline in cognitive ability, and it is the neurodegenerative disorder that usually affects people over the age of 65 years. This is the patient which that is the 65 years or above. So Alzheimer disease is the based on dementia. But what is the dementia? The dementia is the memory loss. If you want to watch that dementia video, so you can search with the Muhammad Umar Farooq in the search bar of the YouTube. The dementia are anxiety, psychosis, and daily activity declines due to the Alzheimer disease. In this case, the brain is involved, but the brain is the contained limbic system, and the limbic system affect first of all the hippocampus, then it can progress throughout the limbic system, like the basal ganglia, thalamus, and the hippocampus is the part of limbic system. But we are not understanding the thalamus, hypothalamus, basal ganglia, or the hippocampus. But we will learn the hippocampus is important for the memory and navigation, while the whole limbic system is important for emotion, rage, as well as thirst and circadian rhythm, and love and hate. The disease progressive initiate to hippocampus to all part of the limbic and cerebellum. Involvement of the Alzheimer disease is the language, the memory, and the comprehension and the attention and judgment, as well as reasoning. The normal function of the brain we will understand, then we will understand about the Alzheimer disease. This is the brain which that inside is the synapse. A lot of synapse is important for the neurotransmitter signaling pathway, which that will lead to give the for the synaptogenesis, memory, learning, and many more. The cognitive impairment, the sympathetic nervous system and parasympathetic nervous system also important for the synapse. In this way, the neurotransmitter release the acetylcholine mostly, which that is Alzheimer disease involved. In this way, the neurotransmitter acetylcholine when decrease, and in this way, the basically is the it is the normal function. This is the hyperphosphorylation of the tau protein, and this tau protein normally not hyperphosphorylation. And in this way, the synapse which that will lead to acetylcholine bind with a postsynaptic neuron from the presynaptic neuron will trigger the depolarization to give the nerve impulse. So the tau aggregation will lead to neurofibrillary tangle formation. This will lead to disrupt the structure of the neuron. But remember the other factor we will also understand. So the pathophysiology of the Alzheimer disease, accumulation of the abnormal neuritic plaques and the neurofibrillary tangle formation. What is the tangle formation? Let's understand about that. This is the brain. So the brain contain basically is the tangle of basically contain microtubules. That microtubule is important for the stability and the anatomical structure of the cell for normal function. But the tangle of the microtubules due to the over phosphorylation, the hyperphosphorylation of the tau protein, which that will lead to intracellular tangle formation to disrupt the structure of the neuron, but the extracellular amyloid beta peptide surrounding, which that also affect. In this, the transmembrane protein is which that it is amyloid precursor protein APP. The beta amyloid peptide should be non-toxic to neuron. So in this way, the protease alpha, beta, and gamma secretase alpha and beta is mostly involved to non-toxic to neuron. But in the case of the beta, then gamma. In this way, gamma secretase enzyme when involved due to the overproduction from the 21 chromosome. So it will lead to gamma to secretase to produce 42 amino acid peptide. Will lead to increase the beta amyloid 42. This is the neuronal toxic, and this aggregation will lead to cause toxicity of the neuron, will lead to damage and the amyloid deposition occur around the meningeal or the cerebellar vessels and gray matter in Alzheimer disease. So in this way, remember that things. I will not explain too much about the meningeal or cerebellar vesicle and gray matter because it is another topic. So let's understand about what is the causes. We will understand the genetic mutation and other the age wise. So this is the neurons, the tangle formation, and the low acetylcholine is the number one cause. And on the other hand, the 5 to 10% mutation in genetics like 21 chromosome, 14 and 1 chromosome, and 2 and 1 chromosome involve to, for example, here is the APP production more and the PSAN production more and PSAN production more. In this way, this type of protein will lead to increase the gamma secretase. It is basically we increase the gamma secretase will lead to beta amyloid 42 increase. On the other hand, the age 65 years, which that will lead to ApoE and small e4 and 19 chromosome involved to produce for the single alleles 50%, for both alleles 90%, will lead to increase this type of the protein is known as the beta amyloid 42. On the other hand, the granulovascular degradation of the hippocampal pyramidal cells by amyloid angiopathy. Anyhow, now we will understand about the different diagnoses. So let's understand about the different type of diagnosis, how to diagnose basically. So the different type Alzheimer disease can occur due to the several reasons like thyroid problems and pseudodementia or body dementia 15%. The vascular dementia also. What is the vascular dementia? The vascular dementia means the memory loss due to the blood circulatory system problem. The frontotemporal lobe 5 to 10% degeneration. On the other hand, the alcohol and drug abuse person, if the alcohol and drug abuse is the identification of the Alzheimer disease, while the vitamin B12 deficiency, and on the other hand, the age associated memory impairment, which that later on progressively increase. Anyhow, let's understand about the treatment and management, how to treat. So basically, I will draw again the structure of the synapse and the neurotransmitter acetylcholine. Already you know about that, when decrease will lead to cause problem. So in this way, like basically you can understand that things basically is the a NAMDA channel which that is important, and in this way the NAMDA channel inhibition is important. So what is the NAMDA channel and what is the NAMDA receptor? NAMDA receptor is basically bind with the neurotransmitter will lead to trigger the calcium influx for the synaptogenesis and other problem. So other things. So in this way the NAMDA channel will lead to influx of the calcium, allow the choline esterase inhibitor and the partially normal methyl deaspartate, the NAMDA antagonist used to inhibit the NAMDA receptor will lead to inhibit the influx of the NAMDA channel. In this way, the antagonists will lead to decrease the calcium accumulate intracellular. On the other hand, the choline esterase enzyme is used to reuptake the choline as well as acetyl. So the choline esterase inhibitors. This choline basically the choline esterase is used for the basically used for the inhibition of the reuptake of the neurotransmitter because already less. The choline esterase inhibitor is the donepezil or rivastigmine and the galantamine. This is the memantine hydrochloride also used for the NAMDA antagonist. So the NAMDA antagonists is used in dementia, dizziness and anxiety as well as the depression and psychosis as well. The evaluation is, let's understand about the evaluation. So the evaluation mean we can see that either the Alzheimer disease are present or not. So the routine laboratory test and complete blood count, thyroid stimulating hormone test, vitamin B12 or check for other causes, CT brain for the atrophy of the brain, cerebrospinal fluid analysis for the low beta amyloid 42, and the top protein check if the top protein are present, and neuropsychological test. On the other hand, the volumetric MRI, the brain imaging like the PET and the fMRI and the SPECT. And on the other hand, the brain imaging and genetic testing as well as the cognitive testing. So the cognitive test. Anyhow, this is the progressive disease, so we should understand the stage of Alzheimer's. The number one stage is nothing basically. It can be identified through evaluation or identified by the blood test or other things. The test, laboratory test, the preclinically or the pre-symptomatic, and in this way, the basically no any chance to understand what the blood test can uh, identify and laboratory by the show the data. So the mild cognitive impairment is the number two step, and later on it will appear, and it will lead to cause language function and the cognitive to work. Continue to work, dementia, and slowly progressing disease. Dementia then will occur. It is the memory loss, and after the dementia it can cause many problems like the incapacitating memory impairment and the language changing, anonia and anomia and the constructional apraxia and the paraphasic errors. 20 to 40% of the patient will have delusion and the visual hallucination common, auditory or olfactory hallucination, disruptive behavior 50%. On the other hand, the sleep and wake patient less and the fragmented sleep more. While in this way, if the 20 years more life with the treatment earlier, if the treatment will earlier, so the 20 years you can live more if you have Alzheimer disease in this way. So that is why I hope you make sense. In this video we have discussed about the Alzheimer disease. This is the neurodegenerative disease, and that is caused by the age factor mostly. I hope you make sense about that. If you like my video, please make sure to share, subscribe, like, and see in the next video. For this time, bye. You can also give the suggestion related to the dementia and the other type of videos.